Hi there, Michelle Mars here again, and welcome to section 3 of lecture 2. Today we're going to talk about, or in this section we're going to talk about scientific knowledge and the scientific method. Now, scientific knowledge is one of the major branches of knowledge currently used in healthcare. But before we look at scientific knowledge, we're going to look at the types of knowledge that are used in healthcare and have been used in healthcare over time. So the 5 different kinds of healthcare that we're going to look in this section are authoritative, intuitive, empirical, rational reasoning, which is the elementary idea of Watson one, and scientific knowledge. So first of all, let's have a look at authoritative knowledge. So authoritative knowledge is, as it sounds, it's about expert knowledge. It's about the idea that the person who is imparting the knowledge or writing about something is expert, that they're qualified, that they're experienced, that they know what they're talking about. So generally experts are people who've published a lot in a particular area. They are the names that you will often see referenced in the literature, or some of the major players and founders of particular systems of knowledge that you may be studying in your particular modalities. You will see references to seminal books and articles and authors. And seminal authors, if someone is a seminal author, it means that they are very influential in their field. Okay, the next kind of knowledge that we're going to look at is intuitive knowledge. Now, when you think of like intuitiveness or knowing something intuitively, it's the ability to think without thinking. It's like, intuition just kicked in then when I was having that conversation with my client perhaps, and I just realised this and this and this. Now, Albert Einstein has famously said that intuition is nothing but the outcome of earlier intellectual experience. I think there's a lot of people that would disagree with that, but certainly our earlier intellectual experiences are a part of how we come to know things intuitively. So being intuitive or intuition is a component of critical thinking. It's something we bring with us when we think about things critically. And it's also intuition, our intuitive knowledge is something that we also want you to develop in this course. So when you come to read something, when you come to see something, you intuitively have a little bit of a feeling about whether it's right or wrong, whether it's something that you should pursue or something that you should just leave behind. So it's very much a part of what makes a good healthcare professional. You can have all the rational reasoning knowledge in the world, all the scientific knowledge in the world, but if you don't have that kind of intuitive component to the way that you think, the way that you interact with people, then you're not going to be making decisions from this wider basis, basically. Okay, empiricism. Okay, this is the idea that all knowledge comes from experience. Remember, it underpins both empirical and scientific knowledge, and it means that we can believe in what we see or experience. So it is the foundation or foundational in both scientific and traditional knowledge, just to reinforce that once again. Okay, rational reasoning. Before, as I said, that's the elementary my dear Watson part of our knowledge or way of understanding health information and other information in the world. So rational reasoning comes from a particular philosophical field of study. Rationalism is a philosophy in which reason is regarded as the chief source and test of knowledge. So you may have seen kind of debates about the difference between intuitive knowledge and rational reasoning knowledge, and both of these knowledges come from different philosophies, different ways of knowing the world. So rational reasoning uses intellectual and deductive reasoning, so there's no room for kind of emotion or kind of spiritual knowledges or any other of those kinds of knowledges in the system of reasoning or in this way of knowing. And like the scientific method, it utilises mathematical models and science. Okay, so the final one that we're going to look at today is scientific knowledge. And scientific knowledge is about observation, identification, description, experimental investigation, and theoretical explanation of phenomena. So it's the idea that knowledge can be systematically developed using the scientific research method. And currently, it's accepted as more accurate than other forms of knowledge, such as consensus-based. So just before we move on to the next section, the types of knowledges that we have just covered in this short section are authoritative, intuitive, empirical, rational reasoning, and scientific. All of these ways of knowing, all of these systems of knowledge are important to healthcare work and decision making. Okay, in the next section we are going to look more deeply at the scientific method.